Thank you.
Hundreds of GPs across England have told the BBC they think mental health problems are being overdiagnosed. BBC News sent a questionnaire to more than 5,000 GPs in England asking about their experiences helping patients with mental health concerns. One commonly held view by family doctors, according to the survey, is that society tends to over-medicalise normal life stresses, but they're also concerned about how hard it is to get help for patients with mental health conditions. Earlier this week, the Health Secretary ordered an independent review into the reasons for a rising demand for mental health, ADHD and autism services in England and where the gaps in support are. Let's speak to Rosie Shire. She's a GP and a member of the Doctors Association UK GP Committee. Dr. Shire, thank you very much for joining us. What's your reaction to those findings?
Good afternoon. I think it's not a surprise to anybody that the number of people seeking help for mental health conditions has increased. I think this survey was sent and there was 5,000 GPs and about 750 responded. So it's only a really small fraction of what we're seeing. But definitely, I think all GPs would agree that more people are coming forward and asking for help with their mental health. And the question is, why is that? You know, we know that there's been an increase in mental health conditions since COVID. Quite a lot of people said that the first time they experienced anxiety or depression was actually during the pandemic. And so it's really, I think we need to celebrate the fact people feel able to ask for help. That's really important, rather than criticising them for asking for help. And then looking at why are they asking for help and what help is available for them.
It's kind of inevitable, isn't it, if more people are coming forwards, that there will be an increase in diagnoses. But you're particularly involved with people who have ADHD. How important is a diagnosis for them?
So ADHD, I think it's received a lot of press because people are saying it's being overdiagnosed. But actually what's happening is that the number of diagnoses are actually catching up with the number of people who've got it. I think we need to think about, why do people want the diagnosis? In an ideal world, people would be able to get support without having an ADHD diagnosis, and the same for other conditions like autism. But actually, the reality is that a lot of people, adults in particular, can't get perhaps reasonable adjustments in the workplace, or they can't get help and support. There's no availability for things like CBT and coaching, which are mentioned in the NICE guidelines as a way to support people with ADHD. They can't get access to that unless they've got this diagnosis. So it's very validating for somebody to understand why they've struggled or why they're struggling with a condition. Is it just me or is it something else? But actually, so often they need the diagnosis for them to get support.
Dr. Rosie Shire, thank you very much for talking to us. There's much more on our website, of course, particularly into that review into mental health and ADHD diagnoses that's been ordered by the Health Secretary.